Okay, we're going to ask ourselves the question, do dental amalgams cause a big prostate? And I'm going to tell you, indirectly, they seem to. Okay? And where does this come from? It comes from this book right here. It's called Mercury Poisoning from Dental Amalgams, A Hazard to the Human Brain, written by Patrick Storterbrecker. It's a magnificent book. This is in the top 50 all-time greatest health books ever written. It was written in copyright 1985. Okay, so this guy, he's like an MD, PhD, brilliant, off the charts, brilliant researcher. Okay, so here's what I'm getting at. He was asked about the dental amalgams and the effect of mercury on the human body, and people would say to him, you know, Dr. Storterbrecker, I think you're full of shit. Okay, how come we don't have more people symptomatic? If these amalgams were so bad and you make such a big fuss about them, why aren't more people symptomatic? And he said, you are. You just don't realize it's coming from the mercury. Okay, well, what did he give as evidence that was a potential mercury side effect? It can make people anxious. They can have anxiety, irritability, moodiness, and back pain, slight tremors. It can cause fatigue in some people. It can cause multiple sclerosis, brain fog. Okay, so what else? It can cause increased salivation, hypersalivation. But here's the big one. Why am I talking about this? Because I made a video yesterday where I talked about how I fixed an annoying problem and how I have to wake up the void at night from sleep. And I joked about having a big prostate. Men joke about having a big prostate, but I sort of had this problem since I was kind of young, around 40. And what I'm getting at is, I think it might be from the amalgams. Storterbrecker calls this micromercurial syndrome. And different people have variable ability to excrete it. I think what's happening is I have good ability to excrete it. And, you know, I never tested my urine, so I don't know for sure. But in life, you have to figure out a working hypothesis in order to decide what to do. Okay, and to the best I can tell, that's what it is. So I'm lucky in the sense that it seems like I excrete it well in the urine because I never had any problems. Mentally, I'm sharp. My mood is good. I got good mood and self-control compared to regular people. I do have trouble sleeping because I got to go to the bathroom, okay? But the fact that it happened to me so young, and like beginning around 40 years of age, and it hasn't changed at all. It's the same ever since I was 40. Makes me think that that's what it probably is. Micromercurialism, meaning minor symptoms due to small amounts of mercury that your body's excreting. So that's what I'm not aware of it causing a big prostate, but it causes the similar symptom. And the reason you want to know that is, don't go getting prostate surgery or something that could give you terrible symptoms and be very painful when this might be all it is. And luckily, because I do other things, I've had to, over time, improve my sleep habits. Like everything, as you get older, you get more fragile, so you have to improve your game, so to speak. I got all kinds of little tricks, you know, like I wear these blue light blocker glasses at night. They have to be yellow tinted to work, and they seem to be helping me. And I got a whole bunch of other tricks. Like after I eat my dinner. When I come home from work, my routine's basically, I call it, shit shower, shave, showtime, okay? Meaning showtime is I make my videos for the night. And I gotta look at these bright lights and stuff. And what I'm trying to say is, after that, it's lights out. And I do that, I have the lights very minimum the rest of the evening before I go to bed, because I want to be able to sleep better, okay? So that's why I do all that, and I wear the blue blocker glasses and stuff, and I got a couple other tricks. I included that once in one of my other lectures when I talked about sleep. So anyways, that's how I do it. Let's see, what else is there to say? Oh, they can cause all kinds of other problems, And again, here's the book. I'll show it to you in here if you want to read it. If you're interested in mercury toxicity, amalgams, and all that, here's the book. It's a magnificent book. And then what do? The smart thing would be to remove the amalgams, but it's hard. Dealing with a dentist is painful, man. Dentists are so ignorant, it's not even funny. They don't know what they're doing. They're not reasonable. I've talked to some dentists, even the ones who've had some training in IOA, OMT, they're the best ones, but even those ones are not easy. A lot of them, their practice is full. If somebody does amalgam removal, they end up having tons of patients. So then their practices become full, and you might not even be able to get to see them. But anyways, that's it. I think that's what it is, micromercurialism. And so, on the one hand, it's a blessing that I excrete it well. On the other hand, it's a pain in the ass that I have to wake up to void at night. So there it is. And the method, what I would recommend is extract them. I haven't got mine extracted yet because I seem to be handling them well, but I might get them extracted in the future. We'll see. I've talked to dentists about it, and they kind of gave me a lot of flack about what they wanted to do. They didn't want to just frankly extract them right away. And I'm like, all right, I don't want to deal with you. All right, anyways, there it is. Hope you found that helpful.